Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I will be discussing about a literature review that was conducted to evaluate the status of injury care among low and middle income countries worldwide. Now, this original research that I'm discussing today was seen in the Indian Journal of Medical Research, which was published by Scientific Scholar. That is hospital level interventions to improve outcomes after injury in India. Now, we all know that trauma is one of the leading causes of disability and death worldwide, and 90% of the trauma related mortality usually occurs in the low and the middle income countries. Now, despite this, there is a paucity of literature emanating that from LMICs, which studies that present or even evaluate feasible interventions that can have a measurable impact on outcomes after injury, primarily mortality. Now, the current article that we're discussing today aims at developing such interventions, key elements of implementation, and also measures of compliance and impact. Now, to give us an in-depth knowledge about this article, we have one of the authors of the study, Dr. Ajai K. Malhotra from the Department of Surgery, University of Vermont, Burlington, Vermont. So, welcome to Medical Dialogue, sir. It's really a privilege to be having you on board here with us today.
Thank you.
Great. So, sir, we're discussing your article that is the hospital level interventions to improve outcomes after injury in India. So, if you could just briefly explain to our viewers what is the rationale behind the study, and if you could also elaborate your observations to our audience, how would you want to highlight that?
So, thank you for that introduction. And I think you framed it very well why this study was needed in the first place. So, we did a few studies in the past where we were demonstrated that the mortality after injury in India is much higher than in the West, which was not a surprise. But what was a surprise is that the higher mortality was much higher for the younger people, the less injured people, and the people who were not in shock. And this was a big surprise to us. This led us to conclude that instead of big things like helicopters and things like that, what really is needed are feasible interventions, which may sound very simple to folks, but they can make a measurable impact. So what we wanted to do was to use the concepts that have been learned in the West, that have really improved mortality in the West, but use them to the Indian context. So that was the primary aim of the study, to develop feasible interventions that are possible in the limited resource settings of India and other LMICs, and be able to present them in a way that can be easily implemented at any hospital.
Great. That's good to know, sir. The rationale that actually led you to carry out such a vast interventional study. Now, what according to you are the major challenges, especially in addressing trauma cases in the lower and middle income countries, compared these to the developed world?
So, one cannot talk about the Indian context without talking about the 1.4 billion people in India. So one is just the overwhelming volume. The second is, of course, always a skills gap, that the appropriate training to the personnel specifically related to trauma. But I would say the biggest challenge is the systems of care. The systems of care, what I mean is that every patient could have an injury from head to toe. So every patient needs a complete examination for not only the obvious injuries, but the hidden injuries. Second, the one concept we have learned in the West is no matter what system you practice in, there are always failures or complications happen. The second element, particularly at the hospital level, that needs to be developed is an ability to rescue this person who may be failing the therapy that you initially put forward. So in that regard, volume, appropriate training, and systems of care, as opposed to each patient being looked at individually.
Great, definitely, sir. Now, to improve the trauma care in the country via the government hospitals, if I have to talk, what according to you will be the stepwise regulations that the government actually needs to bring in?
So one of the things that has worked very well in the US is the concept of trauma centers. And that, I'm glad to say that in India, that concept is really taking hold and developing. But at the same time, in India, there have not been, as far as I know, any standard set of what is a trauma center in terms of what infrastructure is needed for trauma center, what personnel are needed for the trauma center, and as mentioned in the previous question, what processes of care are needed. And among those, one of the things that are very, very important to improve mortality or other outcomes in general is a system of ongoing performance improvement, to be able to evaluate how you are doing, find where you can do better, and then implement that, look at it again. Uh, that performance improvement concept, while present, is not applied as rigorously as, in my mind, that should be. So, the first thing the government, in my mind, should do is develop what standard do you have to meet, does a hospital have to meet to be able to call itself a trauma center. The second element is to rigorously be able to apply that standard. And I can give you an example. I do reviews of other hospitals in the US where I go. They are my colleagues, they are my friends, but I can openly tell them, hey, you are not meeting this standard. And there are times when I have to say, I'm sorry, I cannot verify you as a trauma center. And on the opposite end, I'm the trauma medical director at my hospital. So my colleagues, peers, friends come and visit me and verify. And despite being friends and colleagues, we are very open as to where things could be improved and should be improved. And sometimes, if they really cannot meet the standard, we de-designate them as a trauma center, and then they have to reapply, fix the problem, and so on and so forth. So one, developing standards, and here again, appropriate to the Indian context, not taking standards that are useful in other countries, and then rigorously applying the standards in a very non-judgmental way, and being able to say, okay, to be a trauma center, you have to meet these standards, and currently you're not meeting the standards, so we will do it again later.
Definitely, sir. To get certified as a trauma center, you need to qualify certain parameters. And you correctly mentioned that's when you actually classify a hospital as a trauma center.
That's right.
So now we're talking about trauma, especially in comparing it the developed with the current status in India. We all know that the cost of trauma care in private settings is extreme, and it is basically out of reach for the general population. So how do you define this challenge can be met, especially in lower and middle income countries, and especially those who have very limited facilities?
So I'm going to throw that question back at you and say, how did ISRO put a Mangalyaan around the Mars at 1/10 of the cost that NASA did it? The distance to Mars is the same. It won't change for India or the US, and all the chemistry, physics that has to work just perfect to make that happen. India did it very successfully. And if India had done everything NASA does, India would not have been able to afford that. So the first thing we have to do is understand that there are many ways of doing the same thing, achieving the same results. India is a country that is very, very rich in talent. And second, India truly has the ability to, as we call jugaad, or innovation. And I feel, talking to a lot of people, as you mentioned in the introduction, majority of the literature comes from the Western countries as to how we do it in the West. The way we do it in the West is so expensive that sometimes even very rich countries cannot afford it. So the first thing that has to change is a mindset that yes, it is possible to get equally good results without necessarily doing it in the extremely resource intensive, very, very costly way that is done in the West. The second thing, yes, I mean, India is going to be a $5 trillion economy, which is something to be proud of. But at the same time, India spends less than 2% of its GDP on healthcare. Even Bangladesh spends more than that. The US, it's hitting close to 20%, which we are not able to afford. So yes, the amount of resources that have to be made available has to really increase by orders of magnitude, at least get it to 5%, and that can make a humongous difference. As you pointed out, trauma is the leading cause of death, and the sad part is trauma takes out the young, the economically productive, which is a tremendous hardship on the family. So there is a vast benefit of increasing the resources available to healthcare in general and trauma care specifically, where you are going to be saving the young lives who will contribute to the economy.
Great. Thank you so much, Dr. Ajai, for joining us today at Medical Dialogues and giving us all your valuable insights on your article. It was lovely to be interviewing you here. And thank you once again for joining us at Medical Dialogues.
Thank you very much for having me. It was a pleasure.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.